Pancreatic Cancer Action Network has a comprehensive approach to fighting pancreatic cancer. We're advancing research, supporting patients, and advocating for a cure. And the supporting patients piece of what we do is extremely important, and that is what we provide through our Patient and Liaison Services, or PALS program.
The Patient and Liaison Services program is considered the premier source of high-quality, comprehensive, evidence-based information for pancreatic cancer patients, their family members, loved ones, and health professionals. The PALS Clinical Trials Database contains information on all of the IRB-approved pancreatic cancer clinical trials that are active and enrolling in the United States. So we can use that service to match patients with trials that they may be eligible for based on their personal situation, the stage of their disease, what treatment they've had, where they live. And at the same time, by encouraging enrollment in clinical trials, we're also helping to advance science.
So I will be sending you that email.
When someone calls into the PALS program, they're matched with a PALS associate, and then anytime they need additional information from that time forward, whenever they call back into the program, they're matched with the same PALS associate. The PALS associates can provide information on a wide range of topics depending on what the individual is interested in. Some of those topics include referrals to specialists in their community, so they're seeing a doctor who specializes in pancreatic cancer. Information on side effect and symptom management, so that they're able to handle the side effects of the different drugs that they're on or the symptoms of the pancreatic cancer. We also offer a wide range of information on diet and nutrition, which is a common topic for pancreatic cancer patients.
One of the challenges in helping patients and their families with pancreatic cancer is that they feel very isolated. So an association with a PALS liaison offers patients and their families a sense of connectiveness, a sense of support, a sense of understanding and appreciation for the issues that they're going through that many times they can't readily find in their own communities.
So if you have any questions at all, or if I can help you with anything
When I
else,
called, I told the PALS associate who I was and that my husband had just been diagnosed, and said, I need 3 survivors, and I was very, people that are long-term survivors, who do you have in your database? The physical part of managing the disease was underway. The spiritual piece of taking care of the soul was really a gift that was given through the PALS program in having that survivor to talk to.
to be able to give somebody the name and the phone number of another person who is in the exact same situation they were, somebody who had been given 6 months, who had been told to go home and to get their affairs in order, and who's still here.
It was just an amazing feeling to myself to know that there were survivors out there. And I have to say it was the first hope that I was given after my diagnosis.
To be able to put that phone number in somebody's hand, to be able to say, not only that this person exists, but they're willing to talk to you, and they're willing to share their experiences with you, and they're willing to listen to you. You know, that's something that you can't get anywhere else.
The Pancreatic Cancer Action Network, in particular the PALS program, is one of the most valuable resources for any survivor with pancreatic cancer or family member.
My treatment journey lasted for about 17 months. Every day is a gift.
It's the only organization around that provides this type of information, support, networking, outreach for this specific disease. So all my patients that I diagnose with pancreatic cancer, I actually forward on and introduce them to the PALS program.
It re-energized us again and gave us more meaning and more purpose. And the more people we met, the more excited we got.
We just love this organization. more than any other organization that we're affiliated with, is just so powerful and compelling. And you know, whatever we can do, I think, you know, we'll do it to carry the message.